Welcome to Physio Global. To our regular listeners, yes, we're doing things a bit differently this time. We switched to English for a series of short, bite-sized episodes recorded live at the Pain Science in Motion Congress in Brussels. In this special format, we're diving into the latest insights straight from the venue as we chat with different researchers behind their inspiring poster and oral presentations, giving you quick, valuable insights. This episode is brought to you in collaboration with Pain in Motion. Happy listening. All right, we are at another episode during the Pain Science in Motion Congress. Today there is another guest speaker at this episode. And first of all, I would like to give her the space and room to introduce herself and what her background information is before we get back to the subject.
Hi, I'm Sophie van Dijk. I'm a PhD researcher and physiotherapist. I do my PhD at the University of Antwerp. My topic is on persistent pain and physical activity in different populations with persistent pain. I'm also a teaching assistant, and I've been a physio for over 10 years, where I've did private practice for 6 years, and then since 4 years started my PhD.
Yeah, that's nice to hear. And you started over as well with a poster presentation, double, at this Congress. So can you tell something about this post presentation for this subject?
Yeah, so my poster was actually more about assessment of physical activity in a population with persistent pain. So what maybe something to start off with is we know that physical activity is really important or key in rehabilitation of persistent pain, but it is a challenge for patients to be physically active. So that was our starting point, and in this study we actually really wanted to look at how can we assess physical activity, because if we want to change something, we have to measure it to know if there is a change. And we looked at a specific sample, so we looked at breast cancer survivors with persistent pain, because we know that around 50%, probably 45% of breast cancer survivors has persistent pain after ending treatment.
Oh, that's a big group.
Yeah, so it is a big group, and specifically in that group, physical activity is really needed. And physical activity, we need to, for example, we as clinicians need to assess it to know if there is any change, if that's what we want to do. But also assessing physical activity can be a great behavior change technique for patients themselves. If they self-monitor their behavior and see that physical activity is changing, that really works as a motivation to keep changing their behavior. So for us it was really important to get a better idea of what physical activity evaluation methods, assessment methods can be used, because we also know that there are different types of assessments. We have, for example, the self-reported assessments, what we call more subjective methods. It's just if I would ask you, what did you do last week? How active were you? And you would probably have some idea, but there's a lot of what we call recall bias. We don't really remember last week.
It's just the answer from the patient itself, and that's it.
Yeah, that's it. So you don't have any objective measurement to know, what did we do? What did you do? What was the total amount? But also maybe what type of physical activity, how intensive is this physical activity? So then we have other types of measurements, what we call more objective measurements. In research, we often use accelerometers. I think you can compare it, for example, to a smartwatch. So these are really good assessment methods, but this in private or in clinical practice is not always that user friendly. So it's, for example, you have to wear it consecutively, so all day, all night. It's a small device placed around the hip or the ankle.
24/7.
24/7, and it's a bit annoying, and so that's a bit the downfall of these more objective measurements.
Yeah, it's not always ideal for the patient to
for
use.
the patient, and then that as a consequence often gives different data. So that's why self-report is still something easy to use also as a clinician, but then there you have the difficulty that it's also probably not the best representation because of the recall bias that patients have. So in our study, knowing these benefits and downfalls of both assessment methods, we wanted to see in our sample of breast cancer survivors with persistent pain.
You take only the group with the persistent pain.
Yeah, because we specifically look at persistent pain because we know physical activity is extra important. It's always important for any type of cancer survivors, but also for a healthy population. But for persistent pain, even more the aspect of physical activity. And maybe also even more sometimes a challenge. So that's why we really specifically looked at that sample. So we wanted to know, okay, what is the agreement or discrepancy between these two measurement methods to give us an idea how we could use these evaluation methods in clinical practice. So, for example, if we know that...
And you mean the measurements which are already available, or?
Yeah, so for example, at the self-report, we looked at a questionnaire called the EPAC long form, which maybe is something physios can recognize. And then we used accelerometers, which is indeed an assessment method that's more often used in research. Yeah. But you have...
And not all of them are available for the clinical practice.
Yeah, but there are also some that are available, and it's, I think, maybe...
And for the clinicians who are listening this one, which type is more accessible or more common?
Well, I think, most clinicians will use self-report, but for example, they will often look at maybe people's smartwatch, or for example, you have often a step counts in your iPhone, your phone. Yeah. So that's something that physios might look at, and it's kind of the same idea behind it or system behind it.
For this one,
to measure physical activity. Yeah. So indeed, accelerometers are more research used, but that system is maybe something that physios will recognize from other, smartwatches or physical activity measurements.
Okay. If you look at the stadium of this research project, where are you at the moment in the process? Yeah.
So in this research project, we piggyback a bit of another study. So we use we use the baseline measurement of another study, which is a larger RCT trial, but we only take their baseline measurement, and that recruitment is still ongoing. And as often happens in these larger RCT trials, it is quite a bit more difficult to find patients.
Yeah, it takes more time.
It takes more time, but...
are you still recruiting for the patients?
So right now we are still recruiting patients, but for our aim to really look at these assessment methods, we don't need a full sample of the RCT. Yeah. So that's good news. So hopefully for us, we will end our... recruitment phase at the end of this year. Right. And then, next year we will do the analysis.
There's a high chance this episode will be launched before. So do you want to do a call to action for practices?
So the larger RCT trial is called the Beacon trial, which also is being presented here at the conference. And this trial is looking for specifically breast cancer survivors who still experience persistent pain after ending treatment. And the goal of that study is to give an intervention based on pain science education, but also a behavior change intervention towards physical activity. And it's actually a very, very nice study, I think very relevant and very beneficial for patients. So physios who are listening, who are thinking of specific patients, they can refer to the Beacon trial. They can find it at the website of our research group.
Okay. We will put something on the show notes of this podcast with all the links which are available. So anybody who's listening and want to be part of it, and when it's still open, you can listen to the show notes, and then you see all the information of it.
Mm-hmm. Great.
If you can take a look on the next phase or the future for this one, how is it going to be?
Yeah. So. maybe also, so we looked at the agreement between the two measurement methods, but we also looked at pain-related variables, or we are going to look at how pain-related variables can maybe influence this, because that might be something interesting to know if, for example, you have...
And you mean influence the outcome?
Yeah, influence for example, the over or underestimation of physical activity by self-report compared to the more objective measurements. Yeah. I think that's quite relevant to, for example, if you have a patient where you see a high pain score or a high pain disability score, that you have a bit more of an idea of how much this person over or underestimates their physical activity. We don't know that yet because we don't.
And what is the idea from your point of view? Is it like to analyze this one, and when there's some change going on, is it like to optimize the measurements itself, or is it more like to be aware as a clinician and being more critical about the outcome measurements?
Yeah, more the second part, because I think the limitations of these research of these assessment methods are always going to be a part of that assessment.
Yeah, there's always some kind of amount of limitation for every measurement.
Yeah, exactly. Yeah. But then it would be very interesting to get a better idea over about exactly how much this discrepancy or agreement is for clinicians to know, okay, if this is the amount of physical activity that this patient reports, well, now I have a better idea of how much physical activity she probably actually does, knowing that is people with, for example, a higher pain disability might even underestimate their physical activity that much more. But with this study, we will only be able to tell if these variables are relevant, but not really exactly how relevant. So that probably would be a next step for research, to really look at if we can even quantify the amount of over of underestimation, so that clinicians can have more a valuable tool to know, okay, a person with that score on this pain disability index, then it will probably be this much over or under estimation. Okay. That's the idea.
Okay. Is there anything else you want to share with our listeners?
Well, I think maybe something for as a clinician to take into account that so you can use both methods. So meaning when you use self-report, yes, it has the downfall of the recall bias, but actually it's also something really valuable that you can discuss this with your patient.
Yes, so some kind of tool to use it as a tool as a clinician.
Yeah, and to get sometimes a better idea of how they organize their physical activity. Okay. So questionnaires can really ask about, are you more active in because you have to bike to work, or I can see from your questionnaire that you are quite active during your work hours, but when you come home you're not that active, because questionnaires can ask these questions. And for example, some smartwatch might not always give that information, but could also be just an opening a topic.
So it's not about choosing one or the other. It's about combining it, and for the patient-related measurements, it's all about creating a better view of the story, and getting the discussion and the conversation about it with your patient. Yeah, exactly.
Well. Because physical activity, there are many domains about physical activity. You can look at the total amount of minutes that they are active, but you can also look at the pattern that they do. So I think that's quite relevant that both these types of measurements can help you to get into that conversation with your patients about physical activity and their type of behavior.
It can open doors.
Yeah, exactly. Because it's really important, but it is a challenge that I can recognize, or I acknowledge that challenge. To overcome that challenge, we just need more information, but also opening the conversation with our patients. So I would say, use both and use it as indeed a door for more.
Okay. Yeah, I think personally it's a very interesting subject for the research. It's a complex patient population, and the use of measurements as a clinician itself, combining it, how do you use the outcomes of it together with your patient? I think it's all complex, and it's good to do some research on this one. So I want to share the compliments for that one to start
so
over. And thank you as well for joining in this episode, and that the university and your team is sharing this knowledge as well during some kind of podcast like this. So
thank you. I enjoyed it.
Thank you.
Thank you for listening to this episode of Physio Global. Would you like to discover more episodes? Then visit our website at physioglobal.nl. If you have a question or would like to get in touch, please send an email to info@physioglobal.nl or visit the contact page on our website. And of course, don't forget to follow us on social media. Physio Global, bringing the world of physiotherapy to you.